Today on At Your Service, we will be discussing the resources for students and caregivers related to mental health supports in Anne Arundel County. Today we have two special guests from the Anne Arundel Mental Health Agency. Welcome, ladies. Thank you for joining us today.
Thanks. Thanks for having us. I'm Jen Corbin. I'm the director of the Anne Arundel County Crisis Response System, which is a 24-hour resource offering services for what we call behavioral health, which is any family or individual who's experiencing a mental health crisis, a substance use issue, or really just needs help connecting to resources such as housing, food. We are kind of the interceptor to kind of helping families get to the support they need. The important thing to remember is, I know we're called crisis response, but it's not necessarily, you don't need to be in crisis to call us and look for help. We have mental health clinicians that can help link people to the resources they need.
Thank you, Jen.
And I'm Catherine Gray. I'm the Clinical Director and Deputy Director for the Anne Arundel County Mental Health Agency, and we are the planner and coordinator for behavioral health services for Anne Arundel County. So we collaborate with all of our community partners to identify what the gaps are in service, and then also identify how to fill those gaps, what services are needed for our children and for our adults in the community.
Well, thank you.
Excellent. So you just gave us a little bit of a background of the Anne Arundel Mental Health Agency. Is there anything else you want to add just in terms of what the agency does and how it supports the citizens of Anne Arundel County?
Sure. So we actually do quite a bit, including a lot of training for family members, things like mental health first aid training, resilience trainings. We encourage people to really speak out to help support individuals who are experiencing some mental health symptoms, help guide them how to get help. That sort of thing.
Mm-hmm. Excellent. So in October, we have International World Mental Health Month. Can you talk a little bit about that and how we're celebrating that in Anne Arundel County?
Yes. So International World Mental Health Month is October, as you said. This is really to gain awareness internationally, not just here in the U.S., but really around the world, on mental health issues, and really start to look at how we eliminate some of those gaps for people around the world. Mm-hmm. We also have Children's Mental Health Awareness Month, which is in May. We typically do a big push for resources, engaging the community. There are signs at the libraries that have links to services, and we'll actually be doing the same for International Mental Health Awareness Month. There'll be QR codes at the libraries. You can just scan it and it'll take you right to our website, which has all of our crisis response numbers and also our network of care.
Awesome. And the color to wear is green during the month of
It is
October,
green.
Right?
Yes, okay. Yes. We hope everyone wears green. You don't have to wear it every day, but we do encourage you to wear green.
Awesome.
Awesome. So, Jen, you spoke a little bit about crisis response and the system of crisis response. Can you share with the audience specifically in detail the services and how families can access you, and then go in a little bit more about what those services look like?
Yeah, so it's a big system. Compared to other counties, we have really grown over the last couple of years. I think we're best known for our warm line, which is 24/7, never shuts down. People can call that number in order to kind of ask the questions they need, if they need linkage to something, as well as if they just need someone to talk to. Or get some guidance on next steps. So we call it a warm line instead of a hotline because we're not just fielding calls for people who are at risk of harming themselves or having deep depression, where we're extremely concerned, but we really take any call, and we make sure that we are have a little bit of knowledge about a lot of things. So that's why, I talk a lot about being a connection to resources as well. So we can give you numbers of places to call, but also follow up to make sure you get connected to the resource you need. So that's the one piece. The part that we're better known for is our mobile crisis team, which is our two clinicians who work very closely with the police department, but also go out in the community and help families who may need help at their home. It's a way to get connected and do kind of a quick assessment to see what's going on and how we can better help them get the services they need. But we are on police radio, so a lot of times we get called out because really people's first call is normally to the police department, is to dial 911. And so our hope is to start getting some education out there to say, if it's not a danger to self or others, call the warm line and we'll see how we can help and kind of reduce that need for the police to have to respond to something just to access us. So that's the two parts that I know we're most popular for. We have a lot of other divisions as well once we're out there that we can connect to.
That's awesome. That's fantastic. So when we think about it, and for both of you ladies, so what are some of the biggest issues that are facing families and children when they call the warm line for support?
I think right now we hear a lot of the topic of COVID and coming out of COVID. And that's not just for the kids. I think we're focused on kids returning to school, coming away from virtual learning, but it's an adjustment for the parents too. It's the families who have had parents work from home that are returning, readjusting to schedules and changes, as well as just kids adapting back. Some kids did really well virtually and now going back in the classroom versus kids who struggled being home, getting back. So, we've been in these patterns. And so we get a lot of calls to just kind of help. What can we do to help our child adjust? We work very, very closely with the schools. So we're able to kind of help connect that resource or go out to the schools or talk with the school counselors to say, hey, we go out, we meet with the family, we get releases, and then we just try to help make a connection. This is what's happening at home, talking with the school, and then making a reconnection there. The other thing that we're seeing a lot of is just, we see a lot of parent-child interactions, parenting. Parenting's hard. And so we spend a lot of time kind of talking with families about how to kind of set boundaries, but also how to encourage, appropriate parenting when kids are struggling, and also helping parents understand what resources are out there. And I'd say the last thing that we're seeing is kids are struggling with mental health and parents are scared. And so giving them access to the right resources to understand what to look for. Catherine talked about, we do a lot of education with mental health first aid and just different classes that we can do and trainings to help parents identify early if there is some concern so that we can get children the help they need immediately.
Yeah, that's true.
Yeah, and you mentioned the school system, and obviously we're a great partner. And Catherine, if you could just talk about the relationship between the school system and the mental health agency, and then Jen, if you can elaborate more on the crisis response in that partnership.
Sure. So obviously, Anne Arundel County Public Schools is an extraordinary partner of ours. One of the things that I think is important to keep in mind is prior to COVID, mental health was actually on the forefront of public school administrators' minds already. So these were issues that weren't just suddenly discovered during COVID that our kids are struggling.
100%.
So what we did with our mental health task force is really sort of develop a plan for how do we address this. And that has been phenomenal. What COVID did, though, is really highlighted some inequities we have in our system. It highlighted some gaps that we have with service delivery. But it also provided us an opportunity. We really have been talking a lot about mental health, and particularly children's mental health. But it also leads into questions about the parents' mental health. Being home for 2 years, trying to work and parent children and teach children, and that was really, really hard. But we're really looking at how do we come out of this? How do we provide those services? We were fortunate that a lot of the services could go virtual, but we're finding that kids and families really like those in-person services, those human connections to other people. And that's where the school system is so important, because that's where kids go every day. That's where they get that human connection from their friends, from their teachers, from kids in the hallway. So that piece is so fundamental to really helping children dealing with that social isolation and those anxieties.
Yeah, absolutely. And I think what you said also is mental health being on the forefront. It also has opened up that idea of reducing the mental health stigma, talking about it. It's okay if you're not okay, that statement to just talk about it. And I think that's been a positive that we can look at also.
Absolutely. Yeah. We really are starting to talk about not just, hey, how are you, but really, how are you?
Right.
And not asking once, but asking again. We're starting to notice in our friends and our family members, things aren't as they used to be, and we're paying attention, and that's a really good thing. Now we just need to make sure we're paying attention. What do we do next?
Yeah.
Right.
Yeah, great. And can you talk more about the relationship with the schools and crisis response? Like, what does that look like on a day-to-day basis, and that relationship?
Yeah, so we have a really great relationship now. We've spent a lot of time, I think people don't realize, over the last probably 4 or 5 years, training up our administrators and our school staff to be aware and how to utilize the warm line. And so what we've been able to do is connect with the administration and counselors, and so they can reach out to the warm line, process calls, try to decide what resources they can offer to families, which has been really a key to some successes we've had. Another piece that I think people don't realize is our SROs in our middle and high schools.
Right.
We have our crisis intervention team, which is another part of our crisis system, in which the police department is actually embedded in crisis. And so we have special trained officers paired with clinicians for some of our more severe calls. But what's really cool is during COVID, many of the SROs came in and worked in the crisis system. And so while they already had the training to kind of help out, putting them back in the school after COVID has been a game changer for us. They're able to identify more. They're more able to know the resources because they were sitting in crisis during COVID and learning those resources. So I think one of the key things has just been that wraparound we've been able to do to close that gap in lack of communication. Like Catherine said, I think just building on what we noticed were our gaps coming out of COVID, we've been kind of closing those and really building a better rapport with the school counselors.
Yeah, that's excellent. And you also mentioned the police, and that was something you said earlier. And can you talk about that relationship that you have with the police? Because you said that a lot of times people call the police rather than the warm line, but I think there's a special relationship that the crisis response has with the police that maybe the public isn't totally aware of. Can you talk about that a little bit?
Yeah, so we're really kind of embedded as part of the police department in a way, even though we're a different agency. And I think what's unique is we hear on TV all the time, we need to send more mental health clinicians on police calls. We've been doing that since '99. Our relationship is amazing with the police department. Yes. We have 12 officers, 10 officers, a sergeant and lieutenant housed at crisis response, on top of over, I think it's about 200 people trained in mental health in the police department on patrol. So the goal here now is to get the right officer on the right call. And we're spending a lot of time now, and we have had several school calls even this week, making sure we're getting the right people out for the parents. Do we really need that patrol person there, or do we need our CIT officer in a softer uniform there with a clinician to kind of talk about all the pieces of the puzzle that may be going on there to help answer all those questions we may have and reduce those calls to 911, where that officer can be out there and prepared to do other calls for service. But I think what's been the best benefit to that is when an officer is called to the school, they know to bring us in. And then that allows us to work directly with the counselors, free them back up to go back in to their patrol duty that they need to do.
Excellent.
Well, thank you. But we're going to take a short little commercial break, but we'll be right back in a few minutes. Stay tuned.
Hi, I'm Dr. Mark Bedell, and I am proud to be the superintendent of Anne Arundel County Public Schools, a district of 85,000 students and 14,000 dedicated employees. We are on our way to being the best school system in Maryland, and we could use your help to get there. Consider one of these many careers with us. So what are you waiting for? Apply today and help students like these be AACPS awesome!
Welcome back to At Your Service. So we are joined again today by Anne Arundel Mental Health Agency. So welcome back, ladies. When we left off, we were talking about, crisis response and supports in Anne Arundel County Public Schools, but I'm going to shift. Can you talk a little bit about the network of care and how this supports the citizens and the families of Anne Arundel County?
Sure. So Network of Care is a web-based resource directory. We just relaunched it as a recommendation from the Mental Health Task Force, which we partner with the school system on. What they were really looking at is how do we get the information in the hands of families? And we have Network of Care. It is actually statewide. Anne Arundel County has their own page, which lists all of the services in Anne Arundel County. And it's a behavioral health page, and behavioral health means mental health and substance use. So it is when you go on Network of Care, you can just type in the search bar kind of what you're looking for: therapy, medication management, wellness groups, or you can type in what zip code you're looking for, and you can actually find all the services in your zip code. When you do that, there's a geolocation that will show you on a street level where those services are. So how close is it to home? Is it on a bus line? Those are things that are very important to families. And then it will also tell you what kind of insurance it takes. In addition to that, as a resource, there are articles written, all of them are on an 8th grade level. They are also hand translated into about 40 other languages, so it is not only in English. One of the beauties of that is when you're first dealing with symptoms of a mental health issue, you're not really sure what it is, what to do, where to get help. You can read one of those articles or several of those articles and really get an idea of, okay, I think this is sort of what I'm dealing with. Here's where I get help. You can type in your zip code, you can type in therapy, and a list of providers will come up, and then you just call and make the appointment.
Yeah, that's so convenient. Just the access, especially if you have articles in different languages, because, we have such a diverse population and it is growing. So that's good to know.
Yeah, and so you really laid out how someone how a parent can get into that system and search. What if a parent is not that technologically savvy or just needs that extra support to guide them? Is there a way they can get that support with a Network of Care? Are there any people that they could reach out to?
They can call us directly, or they can call the warm line directly. Yeah, so either the agency number or the warm line number, and we can help guide them through that. Absolutely.
Excellent. Yeah, because I know that sometimes that can be daunting when you are looking for these resources and you just need that extra support to help get you there, right? So it's good to hear that they have that support.
Yeah.
Thanks.
Definitely. So if you could discuss what are some other programs that we haven't mentioned that you offer within your agency, and Jen, if you want to talk about your programs, and then Catherine, if you want to expand upon that, that would be great.
Yeah, I think we spent a little time talking about the crisis system and really the pieces of kind of crisis coming out as things are happening, but there are some really cool pieces to our system that are more of a follow-up piece. We have our care coordination. Like I said, our warm line is not just for people who are suffering with mental health or substance use. It's a resource base too. And so if someone is struggling with maybe risk of eviction or struggling with getting their insurance, or maybe they need an ID, we actually have ways to help them, and our care coordination system can help them. We have care coordinators that can either get on the phone with them and explain to them the process. If they need help, we can meet them down at social services. We have an amazing rapport with our Department of Social Services. So if we need to go down there and kind of help guide them through that, we will. We've met people at the MBA because it's not easy to maneuver. And what I mean by that is some people who have never had an ID, and a lot of times now for appointments, for mental health and substance use appointments, that's kind of where we help. It's not just because you need an ID and you want to go get one, but if you have an appointment and the provider says, make sure you bring your Social Security card and ID, you have to have those to go. And so making sure that people have all of the pieces that they need so that they can be successful to go to that appointment. Because how frustrating is it if you're already struggling to then get to the appointment and realize you don't have the documentation you need. So that's kind of where our care coordinators can help. If you have an appointment and you know that you need a few pieces of documents, we will kind of help explain to you how to get them. The other real cool piece that we have is, it's sad to say, but a lot of people are ending up in our emergency rooms for mental health crisis. Yeah. And if you are, we have a hospital diversion program in which we can help you at the hospital after your evaluation is done. And if you need connection and resources, we have social workers that will actually help guide you through that piece as well. Which is a really important piece. People get overwhelmed. They think that the hospital is going to be the place that sets them up for that appointment when they're in crisis, but they're not. They're just really assessing for safety. And so you end up back home stuck again, not knowing. So we have a good rapport with our behavioral health unit at the ED as well. So we can send people out there to kind of start that process and then follow up with people at home.
Thank you.
So on our side, there's a couple of grant-funded programs that are very, very near and dear to my heart. One is our mentoring program. We have had this for probably about 15 years, and we recently expanded it just because of the demand. We were seeing more and more younger children that could benefit from it, so we opened a second portion of that program. There's another program called Healthy Transitions, also grant-funded, which really kind of helps transition kids from young adulthood into adulthood, so working on employment skills, working on rehabilitation goals, like you know, how to navigate systems, how to navigate doing resumes, that sort of thing. So those are all gaps that we saw that we just added to our system, not funded by any type of insurance, but we have the ability to apply for grants when we see gaps.
Excellent. What you had mentioned, behavioral health, including mental health challenges and also substance use. If we have a parent who's watching or a student who's watching who needs some support with substance use, what would you recommend in terms of them? Would you recommend they call the warm line? What kind of supports are available for them?
I think the first part is to call the warm line and kind of process what's going on and what help they're looking for. But if they're not comfortable doing that, we have our Safe Station program, which is part of the crisis system, in which someone can present at any fire or police station. That's 41 entry points throughout our county where they can go and say that they're looking for help, and one of us will come out and kind of help get them connected. We still encourage people, if you can, call the warm line, let us meet you where you are. But if you're not comfortable with that or you're unsure, you can go to one of those locations and we'll help get you the resources you need. Also remembering that we've worked over the last couple of years with our school system, and they now have the STAR program, which is amazing for our adolescents who can go and if they're struggling with substance use, they can reach out through the STAR program and get the help they need right there in school. But I want people to know that, our warm line is also available, as well as police and fire have taken a big initiative to help us with keep people connected. So it's kind of a warm, welcoming spot where they can wait until we can get to them.
Excellent. I think there are many parents out there who are struggling with that with their children, so it's great to know that those supports are available. You talked about some programs. Can you, Catherine, you want to start, maybe talk about some educational workshops or trainings that are available for families within the county?
Yeah, so we actually try to push a lot of educational workshops out for families. We do them. I'm a resilience trainer for the state of Maryland. So we will go out kind of wherever people are. We do a lot at our public libraries. We've done them in the schools. If there's a community association that wants them, we're doing a couple for churches on a Sunday. Nice. It's anywhere from 60 to 90 minutes, super easy. Teaches some very simple, usable skills. And we do them for adults because we do want our adults to be resilient too. And then parents of teens, and all the way down to parents of 0 to 5s, and then for teens themselves. So, we really look at how we handle our day-to-day stressors. Are we flexible? Are we able to adjust when things happen that we don't expect? So those are all things that we do. We also do mental health first aid training. We have a lot of trainers within the agency that do that. That's an 8-hour training, so that's a bit of a more significant time commitment. But anytime we see gaps in trainings, we either get certified in those trainings ourselves, or we can find trainers, Pennsylvania's not that far, Virginia's not that far, where we can bring them here to our county. You know, we recently had Ken Ginsberg come. He's an expert. Great. He's phenomenal. And that we want open to the communities, to our community members.
Thank you.
Are there any trainings or anything that I know you all do a lot of the frontline work, but are there any things you wanted to add to that? Or
There is actually. We spend a lot of time in the community, whether it's at community events, educating people right at our table, to participating in programs. I'm a trainer for Maryland Family Coalition of Families, in which I do an hour segment there for them. But we also have the Sound of Silence, which is a program in school, which I really, really encourage parents to get out and get to one of those schools that's having it. We're trying to do it in different areas. I think we have 4 or 5 schools already on board for October and November, in which it used to be, it's a spinoff of Not My Child, which was based on the substance use education, but we've taken it to a bigger extent now where we are really incorporating students from our SAD programs, as well as talking about mental health, social media, stressors, along with substance use. So we've really broadened it to kind of hit the needs of what the students told us they see. And so we have a lot of really cool panelists on it. We're part of it, as well as Lieutenant Thomas, who's the head of our crisis intervention team.
Awesome. Great. Thank you.
So let's talk a little bit about services and the difference that services and guardians can access for their children and family. Medicare versus private insurance. You want to talk a little bit about?
Sure. So our Medicare system is really considered our public behavioral health system. Those are individuals with public insurance. Okay. A thing to remember is you don't have to have insurance. You don't have to have Medicaid to access that system. There's actually funding for people who are uninsured or underinsured. So our public behavioral health system is extraordinarily robust in the state of Maryland. We are very, very fortunate to have the number of services that we have. And that goes anything from kind of the low-end services, which are therapy and med management, to targeted case management, to rehabilitative services, to on our adult side, we actually have housing services for our folks with more severe and persistent mental illness. And then all the way up for our kiddos' residential treatment, and inpatient. On our private side, we still have some disparities between our folks with private insurance and public insurance. So the system isn't quite as robust. However, what we have elected to do is apply for some grant funding that allows children with private insurance to access some of those services in our public system. So like our care coordination services, our kiddos with private insurance can actually access those. So that's a really nice piece. The other nice thing is most of our public providers who take Medicaid also take private insurance. So you wouldn't necessarily know whether it's a public provider or a private provider, because the majority now are taking both, and all of those are listed on Network of Care.
That's good to know.
Great.
Good to know.
So as we kind of wrap up, as we celebrate World Mental Health Month, what are some final messages you have for Anne Arundel County Public Schools parents, guardians, students, staff that you would just want to share with them as we bring awareness to mental health and behavioral health?
I think for me, it's just you're not alone. Let's, like we were talking about stigma. Let's break that stigma. Let's make it just like going to your regular doctor for a physical, that going to see someone for your mental health is just as normal. So if we all start carrying that same philosophy around, then there won't be the stigma.
Absolutely.
Right. For me, I think it's just talking about it, being open about what's going on. The more we talk about mental health, like we talk about the weather, the less stigmatizing it is. And that's ultimately our goal. We don't want people not to access services because they're afraid or they're embarrassed or they think there's something wrong. This is a gift to you to be well.
Excellent. Well, thank you both for joining us today. We really appreciate it. And I think our audience has learned a lot. And thank you all for joining us on At Your Service today to learn more about the mental health supports in Anne Arundel County. And we look forward to seeing you next time on At Your Service.